Kuringana na ministry ya UGIMA wa mwiri ti namba nene ya arwaru aria mekinyagia thibitari-ini makoragwo na mweke wa kwiturura mathina mao kumana na itumi ngurani, imwe ciao ari kwaga mwihoko na arigitani. Na reta njira ya kurumia ngwataniro njega gatagati-ini ka arwaru na arigitani, ministry ya UGIMA wa mwiri ni nyitanire na thi yothe hari kuririkana arwaru aria makoretwo magumeirwo ni mirimu ngurani.
The doctor will talk, the patient will nod, or the parent will be yes, 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 but when they leave they ask us what was he saying. That time I was not in the room with them. So you can imagine you have to come back and ask the doctor, what did you tell this patient?
Kuringana na ministry Mukenya wothe ari na kihoto gia gwikinyia thibitari athurimo na heo motungata maria magirire na njira nginyaniru ni arigitani aria mehokeirwo wira ucio.
When healthcare organizations prioritize safety measures, patients are more likely to receive effective, appropriate and error-free care, leading to better healthcare outcomes.
Of all patients and the context of safety in healthcare seeks to assist government and stakeholders to ensure that the voices of patients are heard at the rights to save health.
Arigitani moritio kuheaga arwaru mweke wa kwiturura mathina mao megemaine na mirimu iria magumeire makamathikiriria na gucoka gwetha kihonia gutari na muthutukanio.
I've been suspecting sometimes he doesn't take his medication, so this time I said I'm tracking them. I'll be going after him and checking if he's taken them. And then I go to his room. I find he's supposed to take 4 capsules a day. I go and find it's day 2 and 10 capsules are missing. So I wait for him. I'm like, now I know you throw your medicine. I was like, no, I don't. So how many do you take per day? He said, I take 5. I asked, why do you take 5? He has jaundice and he wants to get well fast.
Maya magithiaga na mbere kiama kia arigitani gia KMPDU morotete thirikari makiuga ndikoretwo ikionania wendi wa kuhingia ciiraniro iria maiguithanirie, makiuga thina uria uri ku ihinda-ini riri ni unyihu wa namba ya arigitani thibitari-ini cia muingi, na kuringana nao undu uyu uracungiriria arwaru kwaga kwamukira motungata maria magirire riria mekinyia mathibitari-ini.
The doctors that are working in these hospitals have to sometimes not to go on leave even if they are sick, because there's no one to replace them. The doctors here are overstretched. They do almost 100 hours per week actually, instead of the 40 hours that has been signed in the collective bargaining agreement.
Handu-ini ha Kameme TV ritwa riakwa ni Wambui wa Njuguna.
Solidarity forever.